you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everybody. And good morning, Harry. That melodious voice you heard is Harry Droves, our station manager. And it's important to kind of recognize that not one person makes things happen. So to have a coordinated effort in terms of your organization, in terms of society, in terms of institutions, it's so important. And this show, although we've done it kind of similarly in the past with having the Yale Center for Clinical Investigation, as well as the cultural ambassadors on the show, and the general topic has been take ownership of your health and your life depends upon it. My guests today are, it's kind of the Roy show. We have Brita Roy and Dr. Brita Roy and Dr. Roy Herbst. But Dr. Roy and Dr. Herbst, before I put you through the third degree, I just want to mention that the show has been really popular, and we advertised it in terms of Dr. Marcella Nunez-Smith being on as well. But I think folks, I just want to apologize for her, and it's really no apology. She's been asked to be part of the President-elect Biden's COVID-19 advisory board, and that announcement officially is today. So she's well occupied, and we really kind of congratulate her. But Dr. Roy, the two Dr. Roys, before I kind of put you guys on the hot seat, I wanted Reverend Perry to kind of ask you to kick us off a little bit, because I mentioned in the last show that the first administration of penicillin was here in New Haven. I think in New Haven and at Yale, we still take things for granted. We know we're a global institution of worldwide influence, but this, the YCCI Cultural Ambassador Partnership, I'm not aware of anything like this occurring anywhere in the United States. There may be imposters and imitators, but sure, it's important, I think, for folks to know we've done shows before, but I don't think we recognize how tactical, strategic, and important something like this is, and particularly since after the results of last week, and I guess some people are still counting, I think everyone has to be aware in some way or the other that if we're going to make any progress in any venue or in any vein, cooperation, discussion, coordination, not being hung up on what your titles or whether you have a PhD or no offense doctors, but whether you have a PhD or MD or no D, but everyone has to kind of, the we the people syndrome really has to kind of become manifest in so many ways. So I wondered if you might want to share just a little bit to kick us off about in fact, why we are doing this. This is maybe our 10th show, but it's so important. And again, we should not take it for granted. This is not happening anywhere to my knowledge, anywhere in the United States to the degree that it's taken place under Tisha Johnson's leadership, et cetera. So kick us off a little bit about why we're doing this show this morning.
I think that it's important that, as you said, it's not about any one individual or any titles, but it's about our community partnerships. And I think that now more than ever, we need to find avenues where we can communicate with a greater number of people, particularly people who may be impacted in disproportionate ways. So we're happy that this media form has been productive in the sense that your audience is our audience, and we are trying to work toward individuals taking charge of their health. So we're happy, we tried to do a show on cancer last month, breast cancer. So we weren't able to get the person we were looking for particularly, but Tisha managed to bring on some experts today so that we could look at that, because it's still an issue. Breast cancer, disproportionately how it affects African-American women, and the colon cancer, particularly when we looked at the tragic death of Bozeman. What's his first name? Chadwick Boseman, yes. And that was just a shock to us all. And so, again, we believe that early early attention given to these situations might bring about better outcomes. And in order to do that, we need to get the word out. But we also have to understand what's going on. You know, why is this affecting us? Is it genetic? Is it some other reason? Is it health? Is it community, zip code? Is it environment? So when we put this together, we're better able to go out and outreach to our community and say, these are the things we need you to look at.
Excellent. Excellent, excellent. Dr. Roy Herbst is with us, and they say, and Dr. Brita Roy. Brita, I know ladies should normally go first, but if we could jump in with Dr. Herbst as well, and then we'll come to your expertise. And the time goes quickly, so I'm not going to interrupt too much, but don't feel pressured. We have a good 45 minutes to really explain and share what's on our heart and mind in terms of our expertise and community benefit. Dr. Roy Herbst, welcome to the show.
Thank you.
They gave me 5 pages to read about you. I'm not going to read anything other than saying that you're a good guy, right?
Try to be, and
Right.
I try to help patients with cancer and try to help them never get cancer by preventing it.
Indeed. So tell us a little bit more about why you're able to kind of invest some of your time with us this morning.
Well, we've seen a revolution in cancer medicine in the last decade. Personalized therapy, new targeted drugs, even better than chemotherapy that treat tumors, immunotherapy. But you know what? All that's not worth anything if we can't get it to the patients that need it, if there isn't access to care. And one of the amazing things we have with Yale New Haven and Smile Cancer Hospitals, we have so many clinical trials. We're getting and studying the new drugs, taking it from those labs, the Sterling Hall of Medicine, and taking it to the clinic. But we want people to get to the clinic. We also want, if we're looking at new targets, we have to understand the prevalence of that target in our community. I live in New Haven, I live in Westville, and I want to care for our community. Certainly we want to be a destination hospital and have people come from all over, but we want to make sure that these trials and these therapies get to our community. And the other thing I'm quite passionate about, Tom, is prevention. As good as all these new medicines are, and I've seen this for 25 years, it's incredible. If we don't prevent cancer and bring people in for regular medical tests and screening, we can help so many more people just by preventing it than will ever help with all these treatments. So colon cancer, as we've mentioned, prostate cancer, breast cancer, lung cancer. We have screening for all this, and we want to outreach to the community. We want people to feel comfortable. We want to provide access. So that's why I was so excited when I got the offer to join you today.
Thank you again for joining us. But let's take a little more deeper dive. And I know Dr. Brita, Roy, you're involved with populations and how we can persuade people to really take ownership of their health. But Dr. Herbst, what are some of the barriers that you see? What do we need to restructure or emphasize more to kind of get the mountain to the Muhammad and Muhammad to the mountain?
Well, I guess it's access, it's trust. Let's take, you mentioned Chadwick Boseman and colorectal cancer. A young man, there's no doubt that colorectal cancer is more prevalent in the Black community. And screening is actually recommended at a slightly younger age than it is for the community in general, at 45 years old. So I think it's important the message go out that it's important to get screening for colorectal cancer. Now, I have all the access in the world, and I didn't have mine until I was 54 because it's hard. You have to have a doctor. You have to have access to get into the center. You have to do a preparation. But having done it, it's a very easy test, and you look and take a look inside the colon and see if there's any evidence of early cancer, and if you know it, or just early anything. And if you find it, you can treat it. So I think things like that, we need to educate. People need to know that it's important to do this. People have to have access to care. If they can't come in, we should go out to them. We actually have a navigator program that Beth Jones works with me on. You might know her, where we go out to the community and we educate people about these tests and then help them to come in. But that's so important. We have these screening tests. I'd love to see everyone have access to it. We have to make sure that there's costs involved, not just the test, which is hopefully some covered by insurances and the government, but also access to get here, transportation. But it's really, Tom, it's people understanding why it's important and also trusting that once we do it, we'll give them good results. And then if we find something, we'll take good care of them.
Excellent. Tisha, let me draw you in again. And again, Dr. Brita, I'm coming to you, so be patient. But I think, Tisha, when people think of the Yale conglomerate, let me just use that phrase in terms of either the med school or the undergraduate school or the professional schools or they just lose sight of this whole, this octopus, if you will. So when someone says the Yale Center for Clinical Investigation, that even confuses them more. But you guys, really, in some ways, you have the potential, the power, and you're really manifesting the glue to many of these research areas. So I want to give you a chance to kind of share a little bit in kind of a few sound bites about why this Yale Center for Clinical Investigation, why that strategic, I would say strategic structural intervention is so necessary.
I think one of the things that, Roy touched on that we've been focused on over these past few shows is just the issue of breaking down the mistrust in the community of both the medical establishment as well as even greater mistrust of research and research participation. So I think that for us, the focus over the past more than 10 years with the ambassadors, and Reverend Perry's right, it's not, you gave me credit in the beginning, but this isn't because of me, it's because of the ambassadors. They are the superstars here, that they've been out in the community carrying this message and making sure that there's information, not only access to information, because I think we all know that part of the issue is not having just the access to information, it's actually being moved to act on the information, which is, I think, what the ambassadors enable us to do from a research perspective. They provide the information in a way, it's coming from a trusted voice. They are getting the answers that the community members need to be able to participate and trust participation in clinical trials. And the issues that Roy mentioned, I think, are just so important. It's not just that issue of screening. One of the things that we know from the data is that oftentimes when minority populations seek, especially cancer care, they're seeking it at a point when their disease has progressed beyond that of their counterparts. And so I think that all of these issues become very important. This is not just about, driving participation in clinical trials for us. It's about really, as Reverend Perry said earlier, taking charge of your own health, getting those screenings done earlier, so that you can really have options. I think we've seen this with prostate cancer, Roy in his specialty of lung cancer. When you're going to do better if you're diagnosed earlier in the course of your disease, you have more options. And I'm hoping that's something that Roy will talk about and Brita will talk about through access to, primary care and other things. But I think these are really important elements. And for us, we just want to make sure that we have the most innovative clinical trials available at Yale, so that that's a part of the pathway for care, is access to innovative therapy.
The Roy show, Dr. Herbst and Brita, Tisha's thrown out that kind of tagline about access to primary care. Roy, would you care to comment on that?
I think it's a big issue. The specialists can't do it all. You need to have your regular exam, and that's so important because, as we've mentioned, you can have early detection of colon cancer, breast cancer, prostate cancer, lung cancer. We're just talking cancer. There are many other diseases as well. So access to primary care, and then lifestyle changes. We ask everyone about smoking. When I met you, the ambassadors, the first time, we talked about smoking cessation and how we have all these programs here where we can help people stop smoking. That's very hard. If you're still smoking, there are reasons, and we can help you with programs, messaging programs, different medications. But these are all things that you need to have good access to your primary care doctor, and that's where the prevention will come. And Tisha said something very important. Cancer is a tough opponent. We see many high-profile deaths, but we are doing better. I've seen it, myself. We all see it, but we want to do better for everyone, and that means preventing it. But if you can't preventing it, finding it at a more treatable, or should I say curable stage. If you find some of these cancers early, we have amazing surgeons. we have radiation oncologists, we have ways that we can treat it. We can combine with some of these new therapies, but we have to find it early. So that means people have to have access to primary care, have to feel comfortable coming to the hospital, not the emergency room, that's okay, but to the primary care setting where they can be seen. If things are found, they can make changes. And again, it's not just cancer, it's all things, but we're talking about cancer today.
Dr. Brita, Roy, before we go into the flu information and the need for people to be aware of the necessity of it, I just wonder whether if you heard anything that's been mentioned thus far that kind of resonates with you.
Sure. Yeah. I'm a primary care doctor too, and as you mentioned, Tom, I work in population health, so I think a lot about how we can really keep our community healthy, so I'm one of those doctors that tries to prevent cancers or catch them early, like Roy is saying. And the things that are really important are there are certain risk factors for various cancers. Smoking is certainly one, but when it comes to colon cancer, there are certain diseases like Crohn's disease or ulcerative colitis, and also cancers can run in families. And so if you have a primary care doctor that you can talk to, and that primary care doctor is aware of your family history, they might actually recommend getting screening earlier, which is super important. So especially, as others have already mentioned, in the Black community, there is a higher incidence or higher rate of things like colon cancer. And we're also seeing higher mortality or death rates from colon cancer. And so that, is due to a combination of things. The higher rates of cancer alone might just be due to family histories. It might be due to other lifestyle risk factors, but especially the higher death rates seem to be perhaps linked to to certain communities not following up on the tests the way that it's recommended. So what I mean by that is if someone has a colonoscopy, so they got their colon cancer screening, and the doctor found a polyp, they might recommend that they should get another colonoscopy in a shorter period of time, maybe in just a few years rather than 10 years, maybe 2 to 3 years. But in the Black community, we're finding that people aren't doing that follow-up on time, which means that by the time they're actually diagnosed with a cancer, because the polyp is before a cancer, but by the time the actual cancer is diagnosed, it's further along. So there's, lots of different things I think that play into this. And for that reason, it is really important, to engage with primary care, and, to follow up and trust in the medical system, I think is part of that too. As well as, as we've already talked about, once a cancer is diagnosed, making sure we have diverse populations in which we're testing new treatments to make sure that the treatments are effective in these various populations. So getting people engaged in the clinical trials is also super important.
We've used as a theme for the various shows, take ownership of your health. And Reverend Clayton and Reverend Perry and Tisha, I gotta tell you, and I guess into the worldwide audience as well, my primary care doctor has recommended that I have a colonoscopy at least 10 times. And my sister did pass away. So I am getting one of those kits that's supposed to be coming to my home. But this is also the second kit that he's sending to my home. And then we had the prostate show, and I'm a prostate survivor. So when you mentioned the family issues, it's definitely, even, I can testify that sometimes we hear information, but don't act on it even to our best benefits. Reverend Clayton, I haven't been ignoring you. It's just we're trying to kind of cover some of the bases. How are you doing this morning?
Doing fine.
Anything that you've heard thus far that kind of connects? I mean, you and Reverend Perry and the other ambassadors have been trekkers. You've been mountain climbers. You've been here for not the sprint, but for the marathon for so long. I'm just in admiration of you guys. But any thoughts before we talk more about the flu situation?
Yes, I would like to go back to Dr. Brita Roy, she was sharing with us that in our community, it seems like the follow-up treatments were, people did not follow up as they should. And I was wondering if we could go a little deeper with that and talk about some suggestions. In one of our YCCI meetings, we had shared that we could bring other family members in, if the husband bring the wife in, so that there's that added support or that added push. So if she could go a little further with that, it might be helpful to our audience today.
Yeah, absolutely happy to. And I think what you bring up is incredibly important, having family support. You know, when the news of like the results of a particular screening test are revealed, and sharing, you know, with other family members what the recommended follow-up is. So one, the person who got the test doesn't feel alone, or, you know, and there's always some fear, right? And anxiety if you find that, you know, your colonoscopy or mammogram was not completely normal. And so when people first hear that news and people are scared and anxious, it's really hard to, I think, really listen and understand like what the next steps need to be. So actually having a partner, a loved one, a spouse, if you adult child, you know, that can be there with you for that news can be incredibly supportive, so that they can also kind of hear it, ask some of the questions, follow up with the doctor if there are questions later on too, and support that family member in getting the repeat test when it's supposed to be done. You know, and as incredibly important as that is, I also want to recognize that there are some probably, you know, structural barriers to that. So it is, I think, you know, a luxury for a lot of people in our community, you know, to be able to take time off work to go to a doctor's appointment, and then also to be able to have a loved one with them as well, because that's time off for them too. So I think we also have to think about, like, you know, what are these other, and we talked about, I think Tom also talked about transportation, right? So there are challenges to access that I think as a community we also need to address that are real. Some things perhaps are a little, might be getting easier or lower some barriers of telehealth, but you know, if you and your partner are both, you know, are both currently people that need to work outside the home, you know, then that might be a challenge. But I think this is something like policy-wise we can try to push for, that employers should allow you know, people to accompany family members to doctor's appointments and things like that. I agree. I think that's really important.
Tisha, let's just take our typical break in terms of people with it, if they're teased or excited or stimulated or even just questioning what we're trying to talk about, how they can find out more about the Hill Center for Clinical Investigation. Just kind of hold our feet to the fire, because this information is so readily available, and it's important for people to kind of go to the website, maybe participate in trials, share information about trials, and just see that this is for them, that it's the We the People syndrome is really, we're really trying to manifest that in a very real way. So for people to kind of reach out and touch us in spite of this social distancing world, what's the best way for them to go about that?
I'm going to let Roy speak. He's been holding up his hand for a little while, and then
I'm sorry, Dr. Herbst, please. Go ahead.
Well, just to go back to Dr. Roy, and I love that people sometimes call me Dr. Roy, but I think that we need to follow up, and one of the things we need is navigation. And you know, we're using, you know, resources you know, at the Cancer Center, and we're using foundation money and other support to have navigators that can reach out and actually go into the community and follow up on these tests and bring people in. But we're also using the navigation to make sure that people do get screened. And I just want to make a case that even during this difficult time, our center is safe. It's much less risk to come in and get screened for these cancers than to wait. And my biggest concern, and I'm sure Dr. Roy's going to talk about this, is that the delays in diagnosis and the delays in screening due to the epidemic. So we're doing plenty of screening now. Where do we screen? Lung cancer. If you're someone who's smoked, if you've smoked a pack a day, 20 cigarettes for 30 years, you're at much increased risk for lung cancer. So we can find it early if we do a CAT scan. And if you come in, not only do we give you that CAT scan, which is non-invasive, you won't even know you had it, but we also give you some work on smoking cessation if you happen to be smoking. And that's a program we have, and I encourage people to look at it. Colon cancer, the same thing. We mentioned, Bozeman. People should come in, in the African-American community, less than 45. At 45, you should have your first scan, others at 50. If you have a family history, of course, earlier. These things can be done, and we'll hear from Dr. Roy about that. Prostate cancer, we have tests, a blood test. You would probably get that at your primary doctor, like Dr. Roy, a PSA, but for higher risk, we can do rectal exams and other things, mammography for breast cancer. All these things need to be done. And we're out there in the community. We have a team, we call it the firewall team, because we feel there's a firewall. People aren't getting the information or access. And then, of course, it's all the issues with trust and follow-up. But, we're doing okay, but we need to do a lot better. And we're certainly committed to that.
Yeah, and also just want to mention in primary care and the U.S. Preventative Services Task Force actually just recently released a new recommendation that all people of general risk, not just African American, but white Americans, Native Americans, Latinas, Asians, should start colon cancer screening at 45.
Right.
So that has, the age has been reduced, I think, because we've been finding cancers at age 50. So the goal is really to start screening before you have any problems.
Tisha, commercial break?
Yep. Commercial break. So, one of the important things, we're obviously here talking about cancer and cancer care, and a lot of data has been presented, but the way that we get this data, the way that we know that we need to move our screening to earlier points, the way that we got much of the data that Roy and Brita are speaking about today, or the Roy Show, as you've referred to them, is through clinical research. The importance of participation in clinical research so that we can get these answers about diseases that are disproportionately impacting the community, even understanding why diseases are disproportionately impacting people of color. And so our cultural ambassadors have helped us to carry this really important message of clinical research diversity. And if anyone listening today is interested in getting more information about clinical trials, we have multiple ways they can do that. If they are a patient within our health system, you can simply log into MyChart. That's where you can get your study result, get your blood test results. You can see where your upcoming appointments are. There's a tab that's labeled research. You can build a profile, and our staff will reach out to you about any trials that you're interested in. You can call us at 1-877-978-8343. You can email us at helpusdiscover@yale.edu, or you can visit our website, yalestudies.org. All of those links have full listings of our available clinical research studies, information about clinical research participation, and addressing a lot of the questions and misbeliefs about what it means to participate in clinical research. So all of those are ways that anyone who wants to have more information can get it easily.
Perfect. Thank you so much. Thank you so much. Your agent is a great job. You've done this well. Brita Roy, talk to us about flu. I mean, it's 60 or whatever outside, but believe it or not, people don't want to, I think, understand that it might be 60 outside, but November is here. You can catch it now. You can catch it through April. What do we do to kind of help people understand and take wise choices in terms of preventing flu, or at least limiting the degree of severity if they do catch the flu?
Right. We deal with flu every year, and every year there are important measures to prevent the flu, or as you mentioned, reduce the severity even if you get the flu. And one of the main ways we can do that is through getting the flu vaccine. And this year, because we're also dealing with the COVID-19 pandemic, having two kind of pandemics, the flu and COVID at the same time, is certainly really challenging for the health system. And already our hospitals are overflowing just with the number of patients we have with COVID, plus all the other patients that are in the hospital. And if we also have high rates of flu, it would be really difficult to treat all of those patients well. And so this year, even more than usual, I think it's incredibly important to get the flu vaccine. And, I have a number of patients that are always worried about getting the vaccine. They don't want the vaccine. They feel like they've never had the flu before, or if they've heard that getting the vaccine will actually give them the flu. And I try to talk to my patients about the fact that, certainly getting the vaccine is not going to give you the flu. It can give people some symptoms of like a cold, because that's your body's like immune reaction to the vaccine, which means it's working. But it's not nearly as bad as the flu. And if you got the vaccine and then later on in the season actually do get exposed to the flu, it is much less likely that it'll be severe, or that you'll need to be in the hospital, or that you'll die from the flu. I treat a lot of patients in the hospital that get the flu each year. And, the number one reason that people either die or end up needing to be on a ventilator or get really severely ill is because they didn't get the flu vaccine that year. And so I can't really stress the importance of this enough. And we're working really hard to make flu vaccines accessible this year, given that it is more challenging with COVID and the physical distancing restrictions. We can't really, have the typical flu clinics where you can just walk up anytime and get it. A lot of places are requiring appointments. Hill Health Center, Fairhaven Community Health Center are both giving the flu vaccine, but you need an appointment. Most pharmacies you do. The community health care van are doing some sites around the city where you don't need an appointment. You can have one, but you can also walk up. We're also working with the New Haven Health Department as well to set up some more flu clinics through the rest of the season. But ideally, again, the earlier, just like we were talking about cancer prevention, earlier is better. So if you can get a vaccine this month or next month, that's going to be a lot better and more likely to prevent the flu or reduce the risk of severe consequences from the flu, as compared to January, February, March.
Excellent. Dr. Herbst and Dr. Roy, we're going to give you the chance to, 3 or 4 minutes toward the end, to kind of share what's on your mind and what revelations you want to share with us, and cancer successes and developments that you've created in the last 10 minutes. I mean, your lab and your researchers, I'm sure, have come up with a cure for cancer in the last 10 minutes. But Reverend Perry, I see you taking notes, and it's been such a pleasure to kind of have you really help to coordinate these series of discussions. So we don't have time for a sermon revival, but we do have time for it. Share with us, because I know you've been taking some notes there and some thoughts, and I've known you over the years. So share with us what some of the things that have been ruminated in your mind.
Well, I think, Tom, the idea of trust is what we look at, but behind trust, there's the antecedent fear. And fear comes from like ignorance and darkness and not understanding. So what the ambassadors try to do is to change the darkness to the light, to bring people into an awareness and a knowledge so that there is no reason to fear. The problem is getting that message out. And there's so many barriers to getting it out. For example, the screening test, we don't know what that costs. And if you're marginalized, if you don't have financing, or you haven't been approach to look at the situation in a critical way, you may just say, like you did with your prostate exams, I'll just keep on waiting until something happens. But if we can get the message out, then maybe we can enlighten people to the fact that you don't have tomorrow to wait for this. You got to work on this now. Yes. So part of what we do is to try to do that. And I think we do that through this show, through our newsletter, through our churches, through our community partners. And I think that's so important. One of the questions I was really interested in is whether or not there is, Roy, any research with lung cancer that is on the cutting edge at this time.
Oh, yeah, thank you. And first of all, thank you to all the ambassadors. I agree with you. What you do in the community, building that trust and letting us know how we can help better is so essential. And the screening is just so important in all these diseases. But lung cancer, it's incredible what's happened. And maybe you all don't know, but some of the first treatments of some of these new immunotherapies were done right on Cedar Street, right on York Street, 10, 11 years ago. And there are patients alive right now with the most advanced lung cancers who got clinical trials. They went on a trial. My colleague Mario Snow, Scott Gettinger were leading a trial. They got these drugs, and I'm meeting these people. This was before I was at Yale. I'm meeting some of these patients, and they're alive and doing well. So what does that mean? We have amazing ways that we can target the immune system, treat the cancer. Li Ping Shen, one of the developers of this, he's at a lab right on George Street. But what good is it if we don't get it to all the people in our community? So that's what I'm really struck with, how we're going to do better. Clinical trials, people distrust clinical trials for good reason. But clinical trials are well regulated in the past, historical reasons. But right now, these trials, if a physician has to think about a clinical trial, he or she has to think about the best standard of care and then can offer some of these new therapies. So I'd like to see everyone have access to these trials. How are we going to do this? One, the navigators in the community, working with all of you, let people know about the trials. If someone has lung cancer, sometimes people don't even refer them in for treatment. Let's get those patients in. Let's figure out how to get them on those trials. Two, we're working very hard to create a more diverse workforce of clinical investigators. That's something I've been very involved with recently. I've just written a grant for that. We would like to see more investigators representing the community doing these trials. We're doing better, but we need to do a lot better in that respect. So we'll do that, and then get more trials that are able to be done in the community. There are some trials that are quite intense and you have to come in, but we want to get trials available at all of our centers around Connecticut. And these clinical trials will raise the bar, Reverend Perry. They'll give new hope. And I want to see those available for our patients. We do better than most communities getting people on trials, but I want to see us even strive for more.
Indeed. And one of the visions and dreams I've had, given the expertise and the resources here in New Haven, we should be the healthiest city on the planet. I mean, that's
absolutely.
It's a personal goal, but I mean, somebody has to lead. We need to take the lead. Reverend Clayton, any thoughts in terms of what you've heard thus far? Reverend Clayton, maybe unmute yourself if you would. If not, there you go. Well, no, you're back.
Okay.
Now you're good. Now you're good.
I had to switch devices.
You're multitask, man. I realize that. You do sermons on Sundays and take time to still stay awake on Monday morning. And who knows? I mean, just the life of a minister is just a blessing in so many ways in terms of the services you provide. Any thoughts?
Yes, we are continually to build trust. We're continually trying to help people remove or ease their minds of fear. We continue to try to educate people of all populations but I would like to use what I call the airplane mode instead of the helicopter mode. We do it on the runway instead of just, we're doing it through this media, through your program. We're doing it through posters. We're doing it through health fairs. We're doing it mouth to mouth. We're doing it in so many ways, and we just thank God for YCCI and for the Tom Ficklin Show and for those that have come on to share with the people to make sure that they can hear that there are ways to prevent lung cancer, there are ways to prevent colon cancer, and on and on and on. And if people would just listen and move in the direction that these experts are sharing with us, I think we'll have a healthier community.
Excellent. Dr. Roy, you're involved with something called the 100 Million Healthier Lives Initiative. I mean, I'm always trying to find out new information, and I'm a content hound, but I'm embarrassed. I had never heard of this. I saw it in your background. And so tell us, I mean, this is fantastic. If you're still involved, tell us. I don't mean, you may not still be involved, but if you are, please tell us about that.
Yeah, I am still actively involved. Although the formal kind of campaign is coming to end at the close of this year, there's certainly an evolution of it that it has spurred. And so the 100 Million Healthier Lives initiative started in 2015, and the goal was to develop kind of unprecedented collaborations with communities, with all sorts of different stakeholders, with the goal of creating 100 million healthier lives around the world by 2020. And from that now has born what's called well-being in the nation. So this term, we said healthier lives, and my role kind of within 100 Million Healthier Lives was to develop the measurement framework. And when we talk to our communities and partners, everyone felt that health is important, but so is well-being. And so just a longer life without high quality of life or high well-being, they didn't really feel was healthy. And so what we're doing is really working with communities around the country and other places in the world to think about how we can co-develop systems and policies and like ways of being together that both improve health and well-being. So you may or may not have seen that in Healthy People 2030, those goals kind of explicitly are related to health and well-being. And hopefully there'll be a lot more to come around that. But that was kind of the goal of the initiative. And I think it did do a really good job of, aligning so many different sectors: education, transportation, the business sector, the nonprofit sector, communities themselves, to think about how we can improve health and well-being.
Tremendous. Tisha?
It's one of the things that, I wanted to say in the show. I think when we started the Ambassadors Program, again, more than a decade ago, one of the various things I heard as we were gathering information prior to meeting with the ambassadors was in a focus group where one of the underrepresented minorities said they would never participate in a cancer trial because they would get placebo, because the doctors wouldn't treat their cancer and they wouldn't, and they would be getting some kind of placebo as part of the research. And that, of course, is a myth. And our ambassadors have been great in helping us to address that. But I was just wondering, since that's such an important point, and we know that that's something that even still is an issue, I was hoping that both Roy and also Reverend Perry and Reverend Clayton could talk about making sure that we address these issues in cancer trials, and people really understand what it means to participate in a cancer trial. And again, as we've made the point before, not all of our clinical trials involve a drug or a device. Some of our trials are around prevention and control and other kinds of things. And so I'm hoping that Roy and then our ambassadors could follow through with, these important points that we want to get out as part of the show.
Dr. Herbst?
Yeah, there are very few, if any, placebo trials anymore. Most trials are testing against standard of care. So I feel reassured if someone's gone on a clinical trial, I at least know they're getting the best standard of care early adopted standard of care that we're offering at Yale or elsewhere. So that's one type of trial, testing a new drug against the standard of care. But many of the trials are early phase trials, trials where everyone gets the drug. The immunotherapy I talked about, the woman who's doing great, and it's not just her, there are many. These patients went on this trial, everyone got the drug. Now, there's no guarantee it will work. And of course, there are risks in early studies, but we try to minimize that now with good testing before it comes to the clinic, very safe monitoring through the YCCI. We have the amazing system at the hospital, and then that brings new treatments forward. And yes, even in smoking cessation, we're doing a clinical trial. So we're taking the best smoking cessation therapy, and then we're adding to it some what we call gain frame messaging, some psychological messaging actually developed in the lab of the Yale president, Peter Salvi. So all of these things are ongoing. And one last thing I want to mention, and I'm very proud of, we're leading a national trial to profile patients with lung cancer, meaning we take the tumor and we analyze it to find out what's causing the tumor to grow or not to grow. We're doing what's called gene sequencing. And in this trial, the sequencing is free. It's provided by the trial. So by getting that trial out, in New Haven and around the country, we're getting access to this profiling to many people who might not have been able to afford it or to get it. And that's expanding the range of care. So clinical trials are a really good thing. They're something that helps patients. We're very committed to it, and we're going to continue to go out into the community and bring even more to you.
Excellent. We have about six more minutes, and I certainly want to still reserve time for both the Roys, the co-Roys. We have the tag team here to kind of share their last remarks. But Reverend Clayton and Reverend Perry, Tisha had referenced whether you wanted to comment on that topic, on that.
Yeah, I think that one of the misunderstandings that members of our community have is that they're going to get a placebo, so why waste their time? But as Roy said, the standard of care with regards to cancer patients is they're still going to get the best standard of care. And if they see that the patient may have reactions or maybe doing not as well as they thought, they can pull them off, or at any time the patient can pull themselves off these research projects. But for the most part, they're going to benefit. And I say that because I had an individual who I worked with who had like stage 4 cancer, and they gave him 3 months to live. He got into a research study at Smilo only because his Yale doctor knew someone and they were able to help him get in the study, and he survived it and went on to do stem cell. But and I say that because when I talked to him, he was so hopeless, and he said, "How can I tell my wife and all of my children? What do I say to them?" But the trial helped him, and I think that so if you have a choice between the risk of getting a placebo or getting something that could save your life, I don't think. And it's the same thing with the Pfizer study, with the vaccine. Some people got the placebo and some people didn't. Now, my daughter got one, I got the other one. I'm hoping that one of us got the right one, but we increased our possibilities of health by participating in this study. And I think for people who are being marginally affected, we don't really have a choice. We can't wait for the cure. We can't wait not to take the vaccine because our community is at risk. Especially if you're an essential worker or you're marginalized. I mean, this is our opportunity to shine for ourselves and for others.
Reverend Clayton?
Yes, Tom, I yield to our healthcare professionals at this time.
All right, you're allowed. You've earned it. You've earned that right. You've earned that right. Let's. We have about four more minutes, and Harry will play the music, and that'll be our. He'll just cut us off if we run out of time. So we have about 4 more minutes. And Dr. Brita Roy, perhaps if you'd like to share some minutes or so of thoughts that you might have, that might be.
Sure, absolutely. So I think just kind of reflecting on this whole conversation, first, again, just can't thank Tisha and the Reverends and this group enough, really for collaborating and partnering with our community. I think it's these partnerships that can really help to make New Haven the healthiest city in the U.S. And another piece, of collaboration and keeping everyone healthy, as we talked about earlier, is really engaging with primary care. We have some really fantastic primary care centers here in New Haven, between Fairhaven and Hill Health Center, and then the new Haven Primary Care Consortium. In addition to Northeast Medical Group and Community Medical Group, we have a lot of really great, primary care centers. And, when people feel okay and people feel healthy, it's easy to ignore. It's easy to put it off. But establishing a relationship with a primary care doctor so that they know who you are, who your family is, what's important to you, and what your health risks are, whether it's, kind of lifestyle behavioral factors like smoking or not getting enough exercise, or family history of different cancers. It's really important for them to know so they can help advise you and help you live, your best life, and help you achieve your goals for what you want to do. And if it so happens, that you need a referral to the cancer center, well, that primary care doctor, might know Dr. Herbst, and I might say, hey, go see my friend, my neighbor. I'm also Westvillean, Dr. Herbst. He's going to take great care of you. But having those relationships, even in the healthcare system, I think can really help, and can help people also trust, the treatments and recommendations. So I think just reflecting on our conversation, I think my strongest push is to really get people to engage with primary care kind of early and often and regularly to stay healthy.
Excellent. Let me thank you now also for taking the time on your busy Monday morning. Dr. Herbst, last words.
I really like what Brita said. We have to work in both directions. Let's work from the primary care towards the cancer center, and the cancer center back to the community. And, again, all these therapies are available at our center. We need to get them to the patients that live nearby. Clinical trials are always tough to enroll to throughout the country, especially for underrepresented minority populations, but we need to reach out, build trust. I don't want someone, Reverend Perry, to have to know someone to get into the trial. They should say, oh, I live here. I have a great hospital a mile or two away. I should go there, and I should have my cancer evaluated in the best possible way. Let's look at the cancer, profile it, understand it. And if it's a good standard of care, I'll get that. But if it's a clinical trial that could help me and has that potential, I want our patients to be on it. And I'm committed to that. And I really, I'm so thrilled to be with all of you today. Thanks for inviting me, Keisha and the YCCI. It's just a pleasure working with you and all that you do. And now, Brita Roy, I have to come meet you. And, it's quite a coincidence that we're here today together. And it's been nice to work with you this morning.
I'm waiting for the music, so until it comes, Dr. Brita Roy, I got to ask you, and this is perhaps not fair because this is a whole separate show, but you're involved with how positive psychology can prevent disease among individuals. Next show. It has to be the next show.
Next show, yes. A lot to say about that.
And Dr. Herbst, personalized medicine. That's the next show too. I get what you tell us about personalized medicine.
Anytime, and I look forward to the day I can come join you in your studio again.
All right, me too. Reverend Perry and Clayton, thanks so much. Tisha, as always. Michael, I didn't call on you, but you've been kind enough to kind of zoom in, and so you're going to be called in next time as well. So be prepared. Everybody, thank you so much. It's the Tom Ficklin Show, and just really keep hope alive, but also take action on your hope. Believe in hope and exercise your faith. Thank you, everybody.
Thank you.
Camera action, I'm ready to go. Way too long, we faced them storms. Now you gon' face the dawn you waited for. I said from night to dawn, I right my wrongs alone. In competition with warnings, ice galore. Now I'm running toward them highlights. I'm finished being a quitter, but little by little, they joking, telling some riddles. Now I'm in my section, ain't willing to give up. Know you getting knocked down, but you gotta get up. I'm never gonna give up. Fall down, I just gotta get up.